Next is dynamic factor, which involve repetitive injury to the cervical cord and can cause dynamic pressure on the cord when flexing and extending. The last pathophysiology is vascular aspect of the spinal cord, which is ischemia as a major underlying pathology event contributing to myelopathy. Oligodendrocytes respond poorly to ischemia, and this may explain the demyelination that occurs with chronic cervical myelopathy.
So what are the treatment given to cervical myelopathy patients? The treatment can be divided into conservative or surgical treatment. For conservative management, doctor can prescribe patient with anti-inflammatory medication, or the best choice is by having a surgery. Anti-inflammatory medication may have some short-term benefit in relieve the painful symptoms of shoulder or limbs. People who have progressive neurologic changes with sign of severe spinal cord compression or swelling are candidates for surgery. The aim of the surgery is decompression of the spinal cord with or without the instrument fusion. As an OT, we contribute into patient's treatment after the surgery. First, we assess patient motor function and their performance ability in ADL, high-ADL, work or leisure, and then identify what is the most valued occupation they want to improve. For example, restore the patient's hand dexterity to button shape and hold a cup. We also can educate patients to practice good neck posture by keeping their head and neck upright when reading, for example. The prognosis for this condition is it tends to be progressive and get worse, but prognosis for recovery is better in patients with early surgery. After a surgery, they may not recover further, but it will stop the progression of the disease and perhaps there will be some recovery, and it depends on the severity of the disease itself.
What are the impairments experienced by cervical myelopathy patients? The first one is decreased range of motion in cervical spine. Next, experience pain at neck and arm area, and lastly, numbness and paresthesia in one or both hands. Person with cervical myelopathy experience some functional limitation. The first one is difficulty to perform fine motor activities such as writing and buttoning shirt. The second one is having weakness of grip strength such as unable to hold coffee cup and difficulty to grip pencil.